Swati, good morning. Sabai Dimai, how's everyone this morning? Well, all of us are having such a wonderful time at HMA, so let's put our hands together for the amazing HMA tea that brings us every year together. You know, there are 7.6 billion people in the world today, and about 13% are older than 60, so that's about 962 million. Turn to 2050, there'll be 9.8 billion people, and the number of people more than 60 will be more than 20%, so 2.1 billion people. Japan has a population of 127 million, and more than 40 million of the population is older than 60. So more than a third of the population is over the age of 60. By 2030, the population over 60 will be more than the children less than 10 years of age. And by 2050, there will be more individuals older than 60 than the population of the world between the age of 10 to 24. And if we look at the population beyond 80, by 2050, this would have increased from 137 million to 452 million. And while there is a lot of focus at present about looking after the geriatric population in the developed world, by 2050, 8 out of 10 elderly people will be in the developing world. To debate this important topic on how is it that we can be ready, we have two panelists, and it's a privilege for me to introduce the two panelists. Professor Bunloo Siriphanich, who's the president of the board of the Mahachai Hospital Group and the president of the foundation of the Thai Gerontology Research and Development Institute. And ladies and gentlemen, guess how old is Professor Bunloo? He is 93 years old, so let's give him a standing ovation. And his co-panelist is Professor Orapitchaya Krairat, who is a consultant in the Faculty of Medicine, Ramathibodi Hospital, Mahidol University. And I'm now going to invite Professor Bunloo for his comments.
May I use my slide? I'm glad to speak here today. I would like to use my slide as the first one, that is AIDS society and how to prepare as hospital management in Asia. First of all, I have to tell you about the definition of AIDS society. You know, the word age, A-G-E-D, some say elderly, some say old people, and some say senior citizen. It depends on what you want to say. But my academic definition of a society is if the people is more than 60 years old in the nation or in the community, more than 10%, that means a society. And more than that, if the nation or the community have the old people, about 20% of population, that means complete AIDS society. And more than that is, if the old people had 30% of total population that is super age society. That is the level of the age society by academic they use. I want to tell you about the world on 2015. That means 3 years ago. World population on the year 2015 is 7,349 million. Population of those age over 60 is 901 million. That is 12% of the world population. So, this world has been a society since 2015. That means 3 years ago. In Asia, on the year 2015, Asian population is 2,449 million. Population of those ages over 60 is 508 million. That is 20.7% of the Asian population. So, Asia has been complete a society since 2015. Now, come to the ASEAN. I think you know about ASEAN. Total of the ASEAN ASEAN nation has 10 nations, and we have 6. My eyes not so good. Let me see this one. In ASEAN, total of ASEAN 10 nations is 630 million. Population of those age over 60 is 5.9 million. That is 9% of ASEAN population. That means ASEAN population is not a society. But if we take a look at individual countries, there are 3 countries that have become a society. One is Singapore. They have 18%. Thailand, 16%. And Vietnam, 10%. While Indonesia has the highest population in ASEAN, but the population of those with age over 60 is only 8%. I would like to recommend for hospital management in Asia. We must consider about a society in Asia. I would like to suggest we should not build a hospital, a GED age or elderly hospital because it lost more than gained. I think we have to elaborate about why lost more than gained, but I have no time. I have told that we have only 20 minutes. But we should collaborate based in the general hospital. Each hospital should have geriatrician to take care of 8 patients. Beside me, or sit next me, is Dr. Orapitchaya Krairat. She is a geriatrician. She may told you how geriatrician can work in the general hospital. Please, Dr. Orapit.
Thank you very, very much, Dr. Bunloo. Many of you are from other countries that not Thailand. But if you are myself and sitting here beside Dr. Bunloo, this is one of the most honorable day of my life to have a chance to be a speaker and sitting next to him. It's a very rare chance for me to, I've been working with him since I've been back to Thailand. That was 14 years ago. And then today is the chance that I sit next to him at the age of 93. What a smart, older adults that I have here on the stage with me. And thank you, Dr. Sibel. Thank you for the organizing committee. Thank you, Dr. Pongpat, for having me as a speaker today. And what I'm going to tell you today is about how geriatrician taking care of their older adult patient in the hospital and how we transfer care from the hospital to home. So first of all, let's get to know our older adults. I don't know, how would you gonna call them? Some people call them silver, golden age, silver age, elderly, but I like the name older adults because older adults is very special. They're just only older than us, right? But they could be quite healthy and strong like Dr. Bunloo is. And what affect the older adults when they are admitted to the hospital, there are 3 factors that need to consider when they are in the hospital. One is the baseline health status, or what geriatricians usually call a frailty type, is that how frail they are to begin with. And then they usually had acute problems or acute illnesses on top of their baseline status. And also with these 2, making them to be in the hospital and then being hospitalization with a prolonged admission period of time, you also create the hazards of the hospitalization. For example, decline in their geriatric functional status, decline in their mental health, their cognitive problem. They usually can develop delirium in the hospital, and they also can be able to help themselves less than before they came to the hospital. And all of these actually results in the hospital outcome for each older adult that is in the hospital. So there are many ways and many studies previously talking about how to improve the care of older adults in the hospital. And basically it comes into four things. One is, first of all, when they are admitted to the hospital, we usually screen them for what we call geriatric syndromes, for example, delirium, dementia, depression, frailty, falls, risk of falling in the hospital, and then we assess their functional status and try to maintain the mobility of them as far as we can. And we implement the intervention to prevent all the geriatric syndromes and also to prevent functional decline while they are in the hospital. And last but not least, we try to improve the transitional care of them from hospital back to their home. So talking about this, we address some important issues when we have the older adults admit in the hospital. And this came in the mnemonic terms called elders. And that's mean eating, mental status, directives for limiting care, the incontinence problem, rehabilitation, pressure ulcer, and discharge planning. From what I learned 15 years ago, and that's the model in the US, which is different from what I have been practiced throughout the 14 years, is first of all, in the US, when it was the fellow there was a development called Acute Care of Elders Unit, or the AIDS unit. And that was a very fancy schmancy hospital unit. And all the patients in this unit usually age more than 65 years and older, with a full multidisciplinary team function in the unit, and also with the environment that appropriate for older adults who change from their usual living places to be in the hospital. That's a lot of money. You need a lot of help. But what I'm practicing is not changing the whole unit. As Dr. Bunloo previously said, it's not going to work in Thailand, and probably it's not going to work in other developing countries. It requires a lot of work, of team members, of environment change, of budgets to improve the hospital environment. So what I have been doing is I do a traditional inpatient hospital setting with a geriatric multidisciplinary team. So talking first about the fancy schmancy model for ACE unit is basically, it's a specially designed hospital unit for older adults. You will see an appropriating light, a calendar on the wall, fixed the nursing staffs with the patients. The nurse come in many times a day, talking, encourage them to get out of bed, early rehabilitation. And it's basically a multidisciplinary working in a specially designed unit. They also have involved in an early discharge planning. That hasn't happened yet here in Thailand over the 14 years. I have had a lot of problem when I first came in. I worked mainly in the university base of the hospital. Budget is one of the limitations of us. And also, lack of the team members is one of another challenges to build an ACE unit in Thailand. From what I've learned and what I've done so far is I built a geriatric multidisciplinary care team, and we involved in the acute care unit of older adults in our hospital. So what we do is the patients still have their own primary care according to whatever they came into the hospital. For example, if they came in with pneumonia, they're going to have a primary care of either infectious disease or pulmonologist. And then we get involved as a consultant. The team get involved. We evaluate them for the usual geriatric syndromes, the baseline geriatric functional status, and we do a discharge planning for their primary care. So we have many members in our team, and that's include us as a internal medicine-based geriatrician taking care of older adults in the hospital. We have a nurse practitioner that's specially trained in geriatric medicine. We also have physical therapists, occupational therapists. We also have a clinical pharmacist. And also we have the team member that's from a family medicine point of view. Many of them help us in transferring care from hospital to home. This model has worked a lot. If you review the literature about acute care for older adults in the hospital, you will see that specially designed unit called ACE unit working quite very well in the US and probably in the European country or Western countries. However, for us, as Dr. Bunloo has said, loss versus gain, the budget, the team. So I have found that having a multidisciplinary team involved in the usual care of the older adults in the acute care hospital works much better. And by doing this, you have to build a lot of professionals that know in geriatric medicine, and that's include the nursing school, medical school, and also we're trying to make general internists and family medicine physicians to know a lot of geriatric medicine to help us. You can't work one by yourself. Seeing the older adults, they are so specialized and individualized, and you can't do it by yourself. You need a team member. So don't be desperate or don't be sad that some of your country, this may not happen yet. Some of it is going on. It took me about 14 years so far to build a very, very strong team from the in-hospital unit. And then we built it as an outpatient care clinic. And also now we're having as a home care team. So doing little by little with the goal of having older adults in your heart, having them as the center of care. And I'm pretty sure that every hospital can incorporate the care of older adults in your usual routine practice in your hospital. Well, I guess that would be all for both of us. And Dr. Sibel will entertain your questions.
Thank you so much, Professor Bunloo and Professor Ora. And your comments really would resonate with everyone here that it's not about creating geriatric facilities, standalone facilities, but it's about integration, it's about collaboration, it's about geriatric units in general hospitals and getting all the clinicians and the subspecialists and the support teams together to build a service. Now, as we were chatting, Professor Bunloo has a question that he wanted me to ask. How many of us here are older than 80? Actually, his question was how many older than 90, but we don't even have anyone older than 80. So Professor Bunloo has some words of wisdom on how to lead a fulfilling life at 93 so that many of us can be here for the next several decades. And ladies and gentlemen, please note Professor Bunloo used PowerPoint with such finesse. He was 63 years old when PowerPoint came into the world. Your comments, sir?
Let me standing to show my strength.
And you can see that he can stand straight up.
This year I'm 93. How can I keep myself to be 93%? Do you want to know how? I have 4 musts in my life. Number 1, eat little.
All right, I failed the first one.
Eat little. My weight is 62 kilograms. 62 kilograms. I keep my weight every day. Eat little. The must number 2 is work more. Work more.
I'm on that. I'm on that so far.
And the third must is, let me think. eat little, work more. More friends. More friends. I have
That's
so many
true.
friends, even in Thailand or other country. More friends. And must number 4 is well prepared. Well prepared. You know, after the World War II, I don't know how you see the World War II. After the World War II, one people asked Premier Churchill of Great Britain, how come Great Britain is a very small country? Why you conquer the war? Premier Churchill said, well prepared, win the war. Well prepared, win the war. So, the first one of me is eat little, work more, keep more friends, and well prepared. You have to prepare everything. The last you have to prepare is to prepare you are going to die. Nobody immortal have to die. You have to prepare yourself to die. What have to do? Thank you very much.
Thank you so much for an absolutely fascinating session. We just have time for one question if someone has one question, but thank you so much for those words of wisdom. Well, I guess we are running out of time. Thank you so much, Professor Bunloo and Professor Ora.
I am Kabir from Gerontology Medical Center in Brunei. I am 74 years old.
Excuse me, Professor Bunloo and Professor Ora. We have a gentleman from Brunei. Please go ahead. Yeah. Just 1 second.
I am 74 years old, 49 years as an anesthetist. I am simply inspired by this 93-year-old, magnificent, fantastic man. God bless you.
Thank you.
Balut, thanks for your comments. And if there's anything that he could answer, any questions, he's going to walk